Thanks, Joe. Thanks, Allie. It's definitely going to be a big year in the State House. No matter when the session actually starts, they've got a lot to tackle, and it's going to be an interesting year. I'm Christy Ariano, a managing director here at CHI, and I have the honor of moderating a talented panel of journalists today who are going to share their insights from the field and build on some of that context shared by Allie and Joe. And I did see a couple of questions in the Q&A that I think some of our panelists are going to get to as well. Our three panelists have varied focus ranging from statewide to national politics and from big picture health policy to very health specific reporting. So joining us today, we have Eli Stokols, White House reporter for the LA Times. Eli is based in Washington, D.C., but we're lucky enough to get him because he did spend time here in Denver as a television reporter, and he is still quite fond of Colorado and what's happening out here. We've also got Linda Shapley, who is managing editor of Colorado Politics, which is formerly the Colorado Statesman and part of the Colorado Springs and Denver Gazette family. Linda was also formerly managing editor of the Denver Post. And rounding out our panel today, we've got Markian Haraluk, who is the Colorado-based correspondent for Kaiser Health News. Markian has covered health and healthcare for 25 years at publications including the Houston Chronicle and American Medical News. So thank you all three for being out here today. We're really looking forward to this conversation. And before we just dive right in on health policy, I want to start with some of the bigger picture in terms of sort of just the political environment and the way you are doing your work right now. So Eli, can you just share a little bit about what it was like this year covering the national campaigns and maybe how it differed from prior years?
Sure. I mean, as everybody watching probably knows, this has affected the way everybody does their work. And everybody's doing a lot more of it from the home office. And so travel and nights in hotels went way down. And, one of the things I've covered basically going back to 2015, since I moved from Colorado to Washington, I covered Republican politics, the Republican primary in the 2016 election, and then wound up covering Donald Trump, obviously, as the nominee. I've covered the White House ever since. When you cover Donald Trump and you go to as many rallies as I've gone to, you realize that you can kind of get a sense for everything that he's doing just as clearly by watching television. This is a president who performs for the cameras, who's always looking for where the cameras are, who wants that audience, and he's always projecting outward. And so in that sense, having to cover his campaign, his presidency from my couch wasn't that great of a departure or that altering of a circumstance, just because that's sort of how I have been processing a lot of his presidency, for years at the point the pandemic hit. It's hard to not be able to go to as many rallies. I would travel when it was our turn. There's a rotating group of White House organizations that cover the White House. We rotate in terms of serving in the protective pool of about 7 reporters who travel with the president at all times. And so when our turn would come up, over the last 8 or 9 months, I would go to the White House. I would get a COVID test in the morning. Then I would have to go out to Andrews Air Force Base, get on the plane, and fly around with him. And you did that with a little bit of trepidation because this is the president who wasn't taking the pandemic as seriously as other people. You were always a little concerned, even if you went through the protocols, got the test. How serious was the White House in terms of getting you the information? How well were they handling the test? Were these Abbott rapid tests really that foolproof, that effective? Were they going to miss diagnoses? And then when you get on the plane, the people who work for the president, whether it's the press secretary or somebody else, a lot of them didn't want to wear masks, wouldn't wear masks. And so you were always kind of mindful of the risk that you might be taking to be in the bubble, to be a part of the pool. But it was helpful to be able to go and to be at some of these rallies and to be around the president and his staff, because ordinarily being around those people is your best opportunity to pull them aside, get them to talk off the record, to try to glean some, trustworthy information about sort of what the thinking was about the campaign or whatever the salient topics were at the moment. And so losing that was obviously it impacted our ability to report. And during the campaign, not being at the rallies, you can see on TV that he always has energetic crowds. And you know, when you talk to Trump supporters at rallies, they often tell you the same thing. So it's not like not being there. You know, I mean, you can kind of guess what people there are going to say, but it's still important for reporters, I think, to get a feel for how the campaign is going, what it feels like compared to 4 years ago or even 2 years ago when the president was on the trail. And so we just have more limited opportunities to do that. And I think, you know, after the experience of 2016, a lot of us were a lot more humble about saying we don't really know what you know, all that much about what's going to happen in this election. I mean, you know, it's hard to predict, and sort of having to cover this campaign at more of a remove made it even harder to really have a sense of how things were going to go on election day.
That makes sense. Thanks, Eli. Markian, I want to turn it to you. And one of the differences, or one of the relatively new things that has come from the Trump administration, has been the allegations of fake news and how that phrase is such a part of the conversation these days. And as a reporter, I'm wondering how these allegations have changed the way you do your job.
Yeah, thanks for the question, Christy. It's discouraging, I have to say, a little bit for reporters to kind of, you know, work so hard and then to have your work questioned like that. But for the most part, it hasn't really changed the way I do my job. I mean, we've always tried to be as accurate as possible, and in those cases where we do make a mistake, we admit that very publicly. We put corrections on the front pages of papers oftentimes. I think the allegation of fake news, what it has done is it's encouraged more reporters and editors to show our work. So, you know, when you do a large investigation, oftentimes there's a box explaining, here's how we came up with this data. Here's how we came up to these findings. So people can see, you know, not just what the results of your investigation were, but the steps you took to get there. And I think that emboldens trust in the work. And, you know, the internet and social media, you know, for all its shortfalls, one of the things it has done is it's allowed us to share our source materials. So if I'm writing about a medical study or a new policy report, I can tweet that link out, and everybody else who's reading my story can then go to source material and see the exact same data, the exact same conclusions that I've been working from. So I think it gives a starting point for a conversation with people who might question whether your work is legitimate, whether you have some bias. So, you know, sometimes they misunderstand the data and sometimes they'll disagree on what it means, but at least there's a starting point from which you can have that conversation.
Well, I appreciate that idea of there are the silver linings to this and that people are showing their work more. That's good to hear. You mentioned social media, and one of the things we see a lot is kind of this idea of two realities right now. People are following the news that they, you know, kind of more conforms to their version of reality. And I'm wondering, Linda, because there's such a division right now and public sentiment is so divided, I'm wondering if you can talk a little bit about how you anticipate this is going to impact the abilities of the parties to govern and compromise in the coming years.
Well, and I think, you know, obviously this doesn't concern healthcare policy so much, although to an extent, you know, regarding COVID-19, it does. But there's just these complete different paradigms that are approaching policy now, where the sides, so to speak, aren't even agreeing on the basic premises. And so with that starting point, that ends up being kind of a really difficult first hurdle to even get past. So I think that, you know, we end up in a place where you hope that everybody kind of agrees on, okay, here's where we are and here's where we have to get to. And then that would be the thing that then would allow various policies to get passed for various, you know, legislations at every level. But when there is so much disagreement on those initial places, that's where you end up having a much more difficult struggle. And so, you know, I mean, when you think about it, like the birth of the Tea Party came about from the enactment of the ACA. And so you end up in this place where, there's a lot of disagreement that is going to come into whatever the next, evolution of that policy is.
Thanks, Linda. Zooming in on health and healthcare a little bit, Eli, can you characterize for us the role that you saw healthcare playing in the national election?
Sure. I think it's useful to sort of come at this question in a couple different ways to separate out the health questions from questions about healthcare from the issue of the pandemic, because those are sort of separate things, even though they obviously overlap. And I think it's also important to go back to the primary. During the primary, you saw just how different these worlds are that Democrats and Republicans are living in. If you watch the Democratic debates, you saw these very, you could almost call them esoteric, although they obviously have real impact, but they were so nuanced, these debates about healthcare policy between, say, Joe Biden and Elizabeth Warren and Bernie Sanders about Medicaid and public options and all these things, that it seemed like every debate, the first 30 minutes was about those issues. Republicans obviously didn't have any primary debates, and Democrats felt coming out of 2018 that healthcare was the issue that helped them really win a lot of competitive congressional races and was going to be important to them in 2020. And this was obviously before we knew that there was a pandemic on the horizon. But it was just remarkable to hear the way Donald Trump would talk about healthcare. He would go out and say, in these very crude terms, he would talk about, I've made healthcare, the greatest, and we're going to protect pre-existing conditions. I mean, he's basically saying, I'm going to protect, and I deserve credit for the central piece of the ACA, even though my administration is in court right now trying to overturn it. And so it was just like, one party was on Mars, the other party was on Jupiter. One party was on Earth, really, and the other party was on Jupiter. But that was sort of the debate. And you get into the general election, which was overtaken by the pandemic, and questions about healthcare and coverage and affordability and access were all the more salient because of the pandemic. But the nuance of, expanding healthcare, how to pay for it, all those questions was really blotted out by the immediate need of, the immediate news story and the crisis of how are we dealing with this? How is the federal government dealing with this? How would a potential Biden administration deal with it differently? And what was interesting was to be out with the president toward the end of the campaign and hear him taking credit for the way things were going, even with the death toll, nearing the 200,000 mark at that point, bragging about testing, bragging at one point about, after he contracted the coronavirus, he bragged about surviving it and basically said this was not that big of a deal. And then on the other hand, you had Vice President Biden talking again and again about, sort of looking at Donald Trump and saying, like, this is not helping. He's the reason why the economy is stalled out because he can't get, focused on the pandemic. So I think the pandemic became the biggest issue for a lot of voters at the end of, throughout the last several months of the campaign. But again, it was just, you have one message from the Democratic ticket that was obviously very focused and fact-based and sort of looking at solving problems. And the president came at this just as sort of a messaging issue and just wanted to convince people that whatever was happening either wasn't happening or that it was actually really good and that he deserved credit for it. And I think that was a big reason at the end of the day for his defeat, even though it is hard to extrapolate, any real clear takeaways from an election like this where you have such a mixed result where the president got more votes than he got 4 years ago. Republicans, in spite of everything, managed to hold on to a lot of Senate and congressional seats, to win congressional seats in the House that people weren't expecting them to win. So it is sort of a mixed result. And it's really hard to know exactly at the end of the day what was driving certain voters when they cast their ballots.
Great. Thanks, Eli. Linda, I want to ask kind of that same question of you, particularly how you saw health policy playing out at the state level, whether it sort of echoes the way it was at the national level, and particularly in the Hickenlooper-Gardner race. Was health care and health policy prominent in that race?
The Democrats, Hickenlooper campaign in particular, made a pretty big deal about healthcare throughout that campaign. Essentially, talking about Gardner's early support of the plan to repeal the ACA, and which led to a number of protests early on for him within the state. And it was a very unpopular position that he had taken. And so the, he tried in numerous debates to say that, he was, for pre-existing, like keeping pre-existing health conditions, some of those kinds of, issues about like the things that people really cared about, in particular in the ACA. But I think that the Hickenlooper campaign probably did a very good job of just painting him as, against this. And so that, of course, ended up, I think, affecting a lot his defeat. But, certainly even on the state level, especially for the Western Slope lawmakers, we saw a number of those state lawmakers who made healthcare cost, in particular, a big part of their campaign. Bob Rankin, Janice Rich, Julie McCluskey, they all, who are all from the Western Slope, especially in that area, Coloradans pay some of the highest premiums and hospital bills, especially in rural areas and in the Western Slope. And so therefore, they made that a big part of their campaigns in terms of just making sure that, that the cost of healthcare was certainly a very prominent issue for them. So we saw that quite a bit. And then, of course, the various parties ran on a couple of different sides. The Republicans definitely ran on free market solutions for healthcare costs. About, even though certainly at the state level they didn't care or, didn't have as much effect on it, but they would talk about repealing the ACA. And then Democrats with Proposition 113, I may have that number wrong, but essentially the abortion limitation measure, Democrats ran pretty hard against that in terms of just, that part of the healthcare issue. And so making reproductive rights part of that discussion as well. So, but, both sides seem to have definitely a lot of support for mental health support and costs associated with that.
And now that the elections and the campaign are in the rearview mirror, I'm wondering, Markian, do you have a sense that voters are expecting big health policy action out of a Biden administration? And I'm wondering specifically how a Supreme Court decision on the ACA might impact that prospect. And I did notice that in the Q&A from Joe and Allie's presentation, there was some question about the ACA. So this is something our audience is certainly thinking about.
Yeah, I think, Democrats obviously have hopes that Biden will be very aggressive on healthcare. I think his hands might be tied a little bit. Initially, first by the pandemic response, that's going to be job one. And two, what happens in Georgia? If Democrats don't take those 2 seats, then Biden and the Democrats have to work with McConnell in the Senate. And Biden and McConnell have had a good relationship in the past, dating back to Biden's days in the Senate. So we'll see how that dynamic plays out. But McConnell takes the same approach he did with the Obama administration. It might be really hard for Biden to get stuff passed. So I think early on, you'll probably see a lot of administrative action, executive orders, trying to reverse the executive orders and the rules and regulations that Trump put into place without a sort of congressional legislation. So you can see things like, eliminating the work requirements for Medicaid, restoring the Obama era protections for LGBTQ people in the health sector. Canceling the public charge rule that was struck down by courts, but it's still, can be appealed and things of that sort. Restore rules on short-term and junk plans. Reverse changes to Title X and contraceptive coverage. And then as the Biden administration, it kind of helps to manage the pandemic. If they start to make progress with that, then I think they turn to the ACA. And I think right now the conventional wisdom on the Supreme Court is it's sort of signaled that they might just, cut the mandate, the individual mandate to buy health insurance out of the ACA, leave the rest intact. That would be sort of a best case scenario, I think. And then that gives the Biden administration a little bit more time to figure out how to fix the shortcomings of the ACA, to build on the ACA. There's already been sort of a proposal floated to change the standard from subsidies from silver plans to gold plans, which would make those subsidies more generous. I think they'll look at fixing the family glitch that makes insurance, the subsidies less accessible to a family versus an individual. They'll push the public option, but again, that's going to be a tough sell in a really closely divided Senate. And I think they'll explore lowering the age for Medicare. And then you'll see other, sort of things around the margins to help with the ACA, restoring funding for navigators and for marketing that will help encourage people to sign up for ACA plans and get the subsidies that they qualify. I think you'll see open enrollment periods extended and special enrollment periods expanded so that more people can sign up. And then, drug pricing is, something that was mentioned already. That'll be interesting too, because Biden has in the past had a pretty cozy relationship. There's a lot of pharmacy in his pharmaceutical manufacturers in his state of Delaware. So he may not be willing to push us as hard on those companies as some people are hoping. So we'll have to see how that plays out.
Eli Markian mentioned that the Biden administration's hands really could be tied coming into next year. I'm wondering what you're anticipating, how you see this playing out, and also maybe what you anticipate that a Biden administration might or should prioritize.
Well, I think Markian really nailed the sort of reality of the situation, which is, look, even if Democrats somehow sweep both of these races in Georgia, you're looking at a 50-50 Senate, and it's hard to see somebody like Joe Manchin going ahead and saying, yeah, let's blow it up and expand Medicaid and let's go crazy with public. I mean, it's not going to happen. I mean, I'm in Washington. You can't even get, a majority of Republicans to accept the election results at this point. We are, we know where the death toll is. We're losing 3,000 Americans a day. The economy is stalling. We can't even get another relief package out of this Congress. And so anybody who is at all optimistic about January and the kind of bipartisan progress that Joe Biden has said is possible and wants Americans to believe in, I don't know where that optimism is coming from if you're reading the newspaper and watching the news every day. I think the Biden administration is going to, when it comes to improving people's healthcare options, is going to, exactly as Markian said, go through and tick off all the executive orders, the low-hanging fruit that they can do to sort of make sure that there aren't these junk plans available and all these other things on down the line. But I really think that's secondary. The main focus, and we've seen this from the president-elect as he's rolled out his health team earlier this week, and as he's talked about the coronavirus, going back several months, that's the priority. That obviously spotlights the importance of healthcare for all Americans, especially in underserved communities. And there will be efforts to expand access, but this is sort of a triage situation, and the most pressing thing is to get this pandemic under control. The president-elect laid out, the sort of 3 points of his plan this week, and that's getting 100 million Americans vaccinated, basically by the spring in his first 100 days in office. That may be ambitious, maybe not, but that's the goal. He wants to do a federal mask mandate, which is sort of more symbolic than anything else, because it's very hard to enforce, and the places where you can actually enforce it are limited to interstate highways, federal buildings, national parks, and again, how people are going to enforce mask mandates, who would enforce that is sort of an unanswered question. Maybe symbolically it matters. Maybe he can convince the country to wear masks, but I think his team also understands that if they're going to accomplish these things and also push to get schools to reopen safely, which is the third point of the plan, they really have to break through a lot of the politics of this that have really calcified over the last several months as the president has taken the issues of mask wearing, the issue of whether or not businesses should be open or have to abide by restrictions. And he's politicized these things and said that people who are taking these efforts in the interest of public health are doing it to hurt you, or they're doing it to hurt me. These are Democrats. We don't want, the Democrats to push these policies. And so I think that's a real challenge for the incoming administration, not just to sort of execute, the X's and O's of getting the vaccines to market and distributed and into the arms of the people who need them, but from a messaging point of view, if he's going to create any space for himself, if he's going to really get people to pay attention when he says, you got to wear a mask, you got to stay home, he has to really somehow break through beyond the people who are already wearing masks, beyond the people who already identify as Democrats and agree with him. And he has to do it in a way that doesn't alienate the other side and make them feel like he's talking down to them. And the messaging challenge of this is really difficult because it has been so politicized. And I think that he and his team understand that. They understand the nature of the challenge, but whether or not they're able to break through to sort of thaw some of the politics around these public health matters, that remains to be seen. But I think that's critical to whether or not he's able to get people to go along with, with his prescriptions. If he's going to get people to trust Dr. Fauci, who, the president's supporters don't like Dr. Fauci. And so it's just, he inherits the politics of the last year or so. He can't just sort of flip a switch and completely wipe that out.
Thanks, Eli. Linda, one difference at the state level is you don't have that sort of divide in the state house and in state leadership. So because we have Democratic control in the state house and the governor's office, I'm curious, Colorado is going to have an opportunity to pursue health policies, things that may not fly, as we've talked about at the national level. Do you expect state leaders to pursue any ambitious policies on that front?
I think Allie actually in her legislative preview, I think that they definitely laid out that, public option, I think, is still very much on the forefront, that it's something that, they tried in the 2019 session, they tried it in the, early part of the 2020 session. And then when they came back from the pause, that they recognized that was probably not something that they were going to be able to finish in that session. And so the expectation is that they will try again, and that they will, find a way to get a public option bill. They see that as, the best way forward. Aside from that, I think, we'll probably see, a number of things, policies that kind of have gone, that they've already started to move forward on, which is like, things related to a healthcare plan that is, outside of your employment, and that, that's obviously part of the public option, but that certainly, so many people lost their jobs when the pandemic hit, that it just makes that more critical. And then I think from there, just other pandemic related things, mental health, that sort of thing, I think will definitely be key issues for them.
Thanks, Linda. Just a reminder to the audience, we are going to try to save a little bit of time for Q&A. So if you do have questions, put those in the Q&A box. Markian, I am curious in the meantime with some of the innovations, things like the public option, but also with recent innovations in Colorado, like reinsurance, community purchasing alliances like Peak Health Alliance, and the possibility of reviving the state public option. I'm curious how Colorado is viewed on a national stage from a health policy perspective.
Yeah, there's definitely a lot of interest in what Colorado is doing, and I get that response every time I write a story about what's happening in Colorado. And it's one of the reasons why, frankly, Kaiser Health News wanted to open a bureau in Colorado, because you have been on the forefront of healthcare reform and been very creative over the last few years. You mentioned reinsurance. Obviously, a lot of states have followed Colorado on that, and the state public option. I think Washington, Colorado, really leading the nation on doing that on a state level as well. So if they can get that done, I think a lot of other states will follow their example. Obviously, a lot has been derailed by the economic crisis caused the pandemic, but I've heard from my sources here in Colorado that there is a desire to get back to that as soon as it's as feasible. The other thing that was derailed was, just before the pandemic, the state issued a bunch of proposals around drug costs, and drug costs is something that's normally been thought of as a federal issue, because most of the laws around how pharmaceutical companies price their drugs and branding protections and things of that sort are federal laws. So, but I was really impressed with some of the creative solutions that Colorado had come up with in that report. And so, I think it'll be a tough sell on the federal level. So I think a lot of states will see if Colorado can somehow pull that off and lower drug costs for their residents. Other states are going to follow suit and try out some of those same approaches.
Linda, this time last year, we saw a lot of focus coming out of Governor Polis's office on healthcare costs, and a lot of that conversation was focused specifically on hospital profits. And given the pandemic and the demands and the focus that we're seeing on hospitals right now, I'm curious if you still see that focus as a viable pursuit.
I think certainly that particular focus is going to change. I mean, even during the pandemic, it's been a case of where the state has changed policies or altered policies in order to help hospitals be able to adjust to the pandemic. And, there's been a lot of discussion about that. Actually, in our Colorado Politics magazine this week, we have a Q&A with Julie Lomborg with the Colorado Hospital Association, where she is talking about just, the way that the state has been a partner for hospitals during the pandemic, and just the ways that they're moving forward and trying to find like new solutions to address some of the issues that they've dealt with. I mean, when the pandemic first hit and they were looking to save personal protective equipment, they, eliminated a huge source of hospitals' income, which was elective surgeries. And so that ended up being something that they've, recognized that was, a way that they were going to need to change how, how they were funded and how they would be able to, move forward and work with all the other things that they need to do, which was buying more PPE and just finding these other ways. So I think that that's going to be a huge conversation going forward. Although, as mentioned, I think even in the chat, there's still a number of hospitals that are reporting, record profits. And so I think that there needs to be some sort of balance and discussion about like how we proceed forward, how we make, healthcare more affordable in a way that doesn't overly tax one industry or another.
That makes sense. Eli, in the same vein, I'm wondering how the pandemic impacts the ability to focus on national health policy, and do ambitious efforts to tackle issues like costs and barriers take a back seat to the more urgent pandemic-related issues?
Yeah, I think the pandemic will be the priority for the first several months and perhaps for the foreseeable future. And I think, given the gridlock that's expected in Washington, I think this administration, the Biden administration, will want to explore every avenue that gives them more space to move in Washington. That gives them that builds their public support. And I think that they see that the most pressing issue for most Americans is getting this pandemic under control, going back to normal. They understand the fatigue that President Trump has appealed to in people in terms of just they're tired of hearing about the pandemic. They want to go outside. They want to go back and eat in restaurants and do all these things. And so I think being able to deliver that, should you be able to accomplish that, should the vaccine distribution go off without too many major snags and happen quickly enough that it doesn't feel like people have been promised vaccines in January, February, and they're not getting them until the end of the year. If that goes fairly well, that could create some space for this administration to come back to Congress and push some other legislative agenda item before the 2022 midterms, which are also going to be incredibly contested given how narrow the margins are in both the House and the Senate. What that agenda item is, though, whether it's healthcare related or whether it's a sort of something that there might be more likely to get Republican support, like a big infrastructure package that you can kind of sneak some climate change stuff, some green job stuff into an infrastructure package. You know, that you hear more about that than some real ambitious agenda item related to healthcare again. Obviously, if the Supreme Court strikes down the ACA altogether, that's going to immediately move to the fore and become something that the president and Congress have to work out. But I don't think too many people are anticipating that. And I just think another reality of Washington is obviously hypocritical, but the fact that Republicans are suddenly not willing to spend money anymore. The deficits have ballooned over the last 4 years, and they are very reluctant to go ahead with modest relief packages now in the lame duck session, and they will be even more reluctant to do that going into 2021 and 2022 with the midterms on the horizon, just because there's a Democrat in the White House, and that's just sort of the reality of Washington. It's sort of cynical, but that's the fact of the matter. They gave Donald Trump sort of a blank check to spend money on whatever he wants, bail out the farmers on tariffs, increase the Pentagon budget. You can go down the list. But when the Biden administration is asking for that money, it's going to be a lot harder for them to get it.
Okay, thanks. So we're starting to get some Q&As coming in. One question from Aaron Miller, and this could be, I think, Eli or Markian. Folks are feeling good. Are folks feeling good about a fix to the family glitch at the federal level? And can you talk a little bit more about that?
Markian, you want to take that one? I just spoke for a while.
Yeah, I don't know. To tell you the truth, I think there's so much up in the air right now. With the focus on the pandemic, the Georgia elections. I think people aren't quite sure what can be done quickly, and how much of our attentions will be driven by these, the immediate concerns with the pandemic. But I think there is a realization that that's a problem, and I think there will be an effort to fix it. How long that takes to do that, that's questionable.
Thanks, Markian. Oh, here's a question that right in our audience's wheelhouse. Will the pandemic finally convince Congress and the states to adequately fund public health infrastructure? Markian, I'm wondering, or actually, I think Linda, did you make a move there?
Yeah, muted. Because, I had something to add about that. But I think that one of the things that certainly, and I've thought about this since the beginning of, a million years ago when the pandemic started, was that that what we're seeing right now is we're seeing a lot of flaws exposed that perhaps weren't noticed as much before because the economy was on an upswing, and everybody was just kind of focused on the election, and but so what we're seeing now is we're seeing all the places where things, when it's not going up, are starting to just break down. And so whether that means that people will finally fix it, I think both Markian and Eli point to the many, many obstacles that are in place for that. But I do think that it's important to see the conversation. It's important to see, especially the conversation around, racial equity in healthcare, that it's important to see those discussions and, to have those types of points brought up, I think is critical. So, and that's, the journalist saying, hey, we need to be talking about this.
Yeah, I'm somewhat less optimistic. I think we have a really short memory, and we deal things. When crises arise, we play whack-a-mole, and we try to get out of the immediate crisis, but we're very bad at looking forward at things. I mean, we've been talking about how there's a pandemic coming for 20, 30 years, and we've had all this money about pandemic preparedness, and it's still caught us off guard. And some of my colleagues at Kaiser Health News have been working on a project looking at what's happening with public health departments across the country right now, and they're under attack. people are threatening them personally. They're threatening their children. They're showing up at their homes with guns, things of that sort. And a lot of these folks in public health are stepping back and saying, I just can't take this anymore. So I think, in addition to the fact that we've emptied out a lot of the coffers that we had for pandemic preparedness, we're going to have to really dig deep and restore public health after this pandemic. It's taken a punch on the chin, and it's going to take a lot to get it back. And I'm not sure that, once we get through this, that people aren't going to shift to other priorities that capture their imagination in the immediacy.
We have famously short attention spans. I will agree with that. I'm going to take one last question, this one from Sharon Adams. She notes that we haven't yet spoken about the COVID-19 crisis in nursing homes and the lack of support early on, and to ensure ensure care for residents and families. So she's wondering, do any of the panelists have any thoughts on this?
Well, I hate to dominate. I can jump in here again. I've been looking into, obviously, the vaccine distribution plans, and there is a national program to bring the vaccine to nursing homes. So it's not necessarily going through the same route as vaccinations for other healthcare facilities. So we'll see how well that works. There's talk about using the sort of National Guard or big chain pharmacies to help do that. But again, I think we've seen long-term care be an issue for a long time, and we're getting deeper into that baby boom generation, who are now starting to enter that age where they need more support, home health, assisted living, long-term care. It's just a really expensive way to do it, and it's a big budget buster for states. So there's going to have to be a day of reckoning coming about how we're going to better support long-term care facilities.
Thanks, Markian.
Just to piggyback on that, I think that it's also it's raised issues regarding staffing, and that they've seen, how the staffers at, so many of our nursing home facilities or, healthcare facilities around the country, that, they've been trying to do that on the cheap, and that's not something that's going to fly anymore.
That's a really good point. Thanks, Linda. We have just a minute or two left, so I want to do a quick lightning round. Just ask each of you in one sentence, if you can, as you look ahead at 2021, what is the one key storyline you think will emerge in health policy? I'll start with Eli.
In one sentence, I would say vaccine distribution.
Thanks, Eli. Linda, how about you?
Support for mental health.
Thank you, Linda. Markian?
I think Eli sort of referenced this, but I think you'll see a lot of pressure on lawmakers due to revenue shortfalls to make cuts in healthcare programs at the federal and state level to get sort of our books back in order.
Thanks, Marky, and I really appreciate that. Thank you all for your insights. This has been a year unlike any other in so many respects, and I think, as you said, we can just anticipate a lot of activity in the year ahead. Thank you all, and now I am going to turn it back over to CHI CEO Michelle Leek to continue a hot issues tradition, the prize drawing.
Yeah, thank you, Christy, and thank you to all of our panelists. You know, this is hard to do, to convert a conference into a Zoom fest. And so I want to thank you all for continuing with that. John Douglas yesterday asked me if we were going to figure out how to Zoom in a bicycle. And while we haven't figured that out, we did think about the bicycle. And we'd like to Zoom it right on over to one of you. We conducted a random drawing as you were all on the line. And we're very happy to share that an old friend of CHI's has won the drawing, Laurel Petralia. And we just want to congratulate her, and everyone is supposed to turn on their cameras. And so Allie, thank you for doing that. Laurel, congratulations. And it's so good to see you again.
Well, thank you, Michelle. And it's always a pleasure to see you. And I remember when you initially started at CHI 10 years ago. I was working for the Colorado Trust, and I'm just thrilled that you're celebrating 10 years and you continue to provide such evidence-based, relevant information. And thank you so much. Wonderful gift. Thank you, everyone.
Great. Well, Laurel, thank you. She was our program officer back in the day. So it seems very fitting that we celebrate my 10th anniversary by you winning a bicycle. So congratulations.
Thank you, Michelle.
As we wrap up here today, I want to thank all of you for joining us. A big thanks to the CHI team, particularly Allie, Joe, Alec, Christy, and those with and without speaking parts here. Joe Hannell, you convinced me that Prezi would work, and so congratulations on that. Thanks to the whole CHI team. We all look forward to seeing you in person next year. And in the meantime, stay safe and be well. Thank you.